Good afternoon. It's time for Volusia Magazine. I'm Amber Patterson. Today we have the opportunity to join Business Beat reporter Michelle Coates for a behind-the-scenes peek at Mystic Powerboats of DeLand. Then health reporter Stephanie Strong will bring us along for a tour of the Port Orange water treatment plant in her report from the Volusia County Health Department. And finally, we'll join Community Information Director Dave Byron in the studio for a discussion with the Director of the Volusia County Health Department, Dr. Bonnie Sorensen. Those segments, news, and more coming up on Volusia Magazine. Stay tuned. Well, you can almost hear that whistle blowing. The Sunrail trains are getting a step closer in Volusia County. Work is now underway on the construction of the new DeBerry Sunrail station. Clearing of the trees and grubbing of the roots is well underway at U.S. Highway 1792 and the Fort Florida Road, the location of the DeBerry station. The next phase of construction will include platforms on both sides of the track. The DeBerry station will be one of 2 Sunrail stations in Volusia County. A second phase extension of the Sunrail would add another station in DeLand at the old Amtrak station.
I believe that this is one thing that the city of DeBerry needs for economic development, and growth in the city. I believe that this is probably one of the most crucial things that the city of DeBerry is ever going to have coming to the city. It has the potential of creating jobs, which is the #1 concern in this country right now. Most of our people that live in DeBerry and in Deltona and Orange City, a lot of them, a good percentage, work in Orlando. So we have a great tie-in from there as far. And also it's so close to I-4. Now with the prices of gas going up the way they are and everything, I believe that this is going to be essential.
The 2 Volusia County stations will cost an estimated $88 million through the year 2036. That cost includes the county's commitment to maintain the 2 rail stations, the county's contribution to capital costs, as well as other rail operations after Sunrail has been operating for 7 years. Volusia County Chair Frank Bruno said it's a worthwhile investment for Volusia County.
The county's financial commitment to the project is $88 million, and that's through 2036. And so it is a worthwhile cause. It's a worthwhile project for Volusia County. The state of Florida actually has the operations for the first 7 years. It is economic development. It's going to bring more tourism into Central Florida, and you've got to remember that Central Florida and the corridor from the Tampa Bay area to the Daytona Beach area is the 10th largest economic corridor in the whole country, and so it's important for us to have mass transit.
Bruno serves as chairman of the Central Florida Rail Commission Governing Board, which assists the Florida Department of Transportation with policy direction during the planning, design, construction, and first 7 years of operation for the Sunrail system. The 31-mile first phase of Sunrail will serve 12 stations linking DeBerry to Orlando. Phase 2 will serve 5 additional stations north from DeBerry to DeLand and south from Orlando to Point Siena. Service is expected to begin by 2014.
Just the transit-oriented development around the station is going to mean millions of dollars funneling into construction projects, as well as jobs, and we can certainly use those jobs right now.
Sunrail will operate on weekdays every half hour during peak morning times from 5:30 a.m. to 8:30 a.m. and afternoons from 3:30 to 6:30 p.m. It will run every 2 hours during non-peak periods. The cost will be $2.50 to ride in one county and $1 for each additional county. Spring not only brings April flowers and May showers, it also ushers in the beginning of sea turtle nesting season. Visitors to Volusia County beaches and residential and business owners along the coast are encouraged to help ensure a productive nesting season.
We have a lot of educational signage out along the beach, specifically regarding sea turtles. We do try to educate people about not only the sea turtle lighting ordinance, but also just to remind people to let sea turtles do their natural behaviors without being disturbed. So if you have a sea turtle nest that you're nearby and you see, it will be clearly posted with a sign that says keep outside of the barrier. You know, any kind of tampering with the sand can damage the development of the eggs that are buried underneath the sand. So those are some of the big things that we just ask people to do, is just stand back and you know, observe and don't tamper with anything.
Sea turtle nesting season is when female sea turtles leave the ocean, usually at night, to lay eggs on the beach. The nesting usually begins in early May and continues into August. The hatching of the eggs usually happens between 48 to 60 days from the date the nest was laid and will continue through October or until the eggs have hatched.
What we're learning from state scientists is that the numbers of leatherback and green sea turtles nesting throughout the state of Florida has been on the rise in the last few years. And in 2011, Volusia County had a record high number of leatherback nests, which was only 13. It doesn't seem like a whole lot, but in retrospect from the nesting numbers we've had by leatherbacks, that's really a big number. And this year, we've actually had warmer than average water temperatures, and we've already had one leatherback nest that was laid in early April. So we can anticipate we might see a high number of leatherback nests again this year. Each season, we don't know what to expect. You know, we do know we'll get lots of sea turtle nests. We don't know how many or what species we'll see the most of, but it's always an exciting thing to look forward to.
Our beaches provide an important nesting habitat which helps ensure the continued existence of the loggerhead. This nesting season, property owners, businesses, and visitors to the beach should watch for bright lights. Volusia County has a lighting ordinance that states that no artificial lighting sources can be visible or illuminate the beach at night.
The Volusia County lighting ordinance actually follows the statewide model lighting ordinance that the Florida Fish and Wildlife Conservation Commission manages throughout the state of Florida. Sea turtles are endangered and threatened and protected species, and lighting has been shown to be one of the major problems with their reproductive cycle. They only come out of the water, only the females come out of the water during the summer to lay their nest on our beaches, and each nest has on average over 100 eggs in it. And so during the summer, Florida is producing lots of baby turtles, but unfortunately a lot of baby turtles are lost because they get misdirected away from the ocean because of the lighting.
You can learn more about turtle nesting season at volusiaseaturtles.org.
Hi, I'm Joyce Cusack, Volusia County Council member at large. As tough economic times continue, Volusia County residents and visitors are seeing the value of public transportation. During the last fiscal year, VoTran had more than 3.5 million boardings. VoTran offers a variety of services, including fixed route buses, a beachside trolley, van pooling, and a gold service for people who can't ride fixed route buses due to disability or age. At $1.25 a ride, VoTran drives a great bargain. For more information about VoTran, visit votran.org.
DeLand-based Mystic Powerboats Incorporated has inked a deal to build a $2 million turbine-powered racing boat for the Qatar Marine Sports Federation. The boat should be ready by March 2013, just in time for the Miami International Boat Show. Mystic employs 11 people, and company officials expect to hire 2 more workers to help fill the latest order. We joined Michelle Coates for the Business Beat, and she joined Economic Development staff for a tour of Mystic Powerboats last year.
Hi, we're here in DeLand at Mystic Powerboats, where Volusia County's Economic Development Department is using Florida's Economic Gardening Program to help Mystic keep its roots here and bloom. Mystic Powerboats is a high-tech, high-end boat designer manufacturer founded in 1996 by John Kosker. The $1 million-plus powerboats and high-performance luxury yachts are built with cutting-edge carbon fiber and epoxy construction.
We're very high-end race boats, very exotic. We don't build a lot of boats, but we build, right now we're doing 4, maybe 5 cats a year. We also have a yacht line.
The company and its signature 200+ mile-per-hour high-speed boats is ready to move to the next level. Volusia County Economic Development Department is using a state pilot program called Economic Gardening to keep Mystic Powerboats in Volusia County and move the company to another level. Economic Development's Business Assistance Toolbox includes resources and partners to help businesses with workforce development, finance, exporting, procurement assistance, technology outreach, expansion and growth strategies, product commercialization, and economic gardening.
We try to help all of the companies in Volusia County as best we can. We have a regular business visitation program in order to see what resources we can help them in order to grow.
Mystic Powerboats produces boats that are well suited to the European and Middle Eastern markets. International expansion is the next step, but company leaders well versed in the technology of building amazing powerboats weren't as sure-footed on the path to international markets.
We can grow both economically, export, and technologically. There's technological corridors in the area in Florida here with different universities that make labs and things available to us to bring our technology at a whole new level. There's support in export and getting exposure overseas.
The workforce is the blood of any company, and Mystic isn't any different. The crews take tremendous pride in building these masterpiece crafts, but training is a must and a hurdle.
With Mystic Powerboats, we are helping them work with Workforce Florida, the state's workforce agency. They have a source of funds called the Quick Response Training Program. And that Quick Response Training Program is an incentive fund to help businesses either locate here or an existing business to remain here and expand here.
When this availability came to us, it was really incredible. So it's a huge opportunity for us to recoup a lot of training dollars that we really put into people and to keep them here.
Economic gardening involves a host of city, county, and state partners committed to helping second-stage companies achieve their potential. Mystic Powerboats is a case study for how Volusia County's Department of Economic Development works with businesses in Volusia. The department is a resource for all Volusia County businesses. Boating in Florida is an $8.5 billion industry, and Mystic Powerboats is part of it here in DeLand, Volusia County. I'm Michelle Coates for the Business Beat.
Few things in life are as important as having access to a safe, plentiful supply of drinking water. The Volusia County Health Department is responsible for inspecting local public water systems to make sure they are in compliance with state and federal laws. Public Information Officer Stephanie Strong takes us along for a tour of the Port Orange Water Treatment Plant in this segment of Community Health Matters.
The Volusia County Health Department is responsible for ensuring public water supplies of Volusia County provide water to consumers that is safe and in compliance with federal and state regulations. Whether you're home, at work, engaged in recreational activities, or being entertained, residents and visitors alike can have confidence in the public water supplies of Volusia County.
Our Safe Drinking Water Act program implements the federal rules here locally, and those rules are designed to protect our drinking water resources.
The Health Department takes a number of steps to ensure your drinking water is safe. The Health Department works closely with regulated water systems, other regulatory agencies, consulting engineers, physicians, and the general public. Environmental health specialists make frequent and thorough inspections. Closer oversight of regulated water systems means higher compliance and safer water.
We work closely with the various utilities. Our inspectors go out there regularly, make sure everything's going fine. They're also available for one-on-one consultations, and this is helpful to the operators. They can gather from our expertise, and we kind of share things locally when our inspectors go to plant, so it's good in that regard.
Proactive rule compliance training allows owners and operators to stay abreast of complex rules requirements. One-on-one technical assistance helps owners and operators develop cost-effective treatment protocols. The Safe Drinking Water Act program works directly with the local medical authority, the public health officer, and a team of experts. Environmental specialists respond promptly to natural or man-made disasters or emergencies.
Many people don't realize that the health department has several roles following a natural disaster or hurricane or flood. Our environmental specialists are involved in inspecting wells and helping homeowners understand how to decontaminate their wells if they've been flooded. Our environmental inspectors often inspect feeding sites and shelters to assure the safety of the water and the food. They also work closely with our community water systems to assure that our tap water is safe after a hurricane or a flood.
Citizens and visitors with questions and concerns about drinking water are encouraged to contact the EH field office nearest their home. The Volusia County Environmental Health Lab offers routine and emergency water sample analysis, as well as the Department of Health Regional Laboratory in Jacksonville. The Safe Drinking Water Act program receives high grades regularly from the Department of Environmental Protection and Department of Health audit teams. The program has an overall excellent rating.
People watch us. We get audited regularly, both by the Department of Environmental Protection and the Department of Health. And our recent audits have just been wonderful, and our program has been noted as being excellent. So we get a lot of feedback.
For Volusia Magazine and on behalf of the Volusia County Health Department, your guide to better health, I'm Public Information Officer Stephanie Strong.
If you have any questions about this or any other health-related issues, you can log on to volusiahealth.com. And now let's join Community Information Director Dave Byron in the studio for a chat with Health Department Director Dr. Bonnie Sorensen.
Thank you, Amber, and hello, everyone. The Robert Wood Johnson Foundation at the University of Wisconsin has just released its third community health rankings for every county in America. This is a snapshot of how healthy their residents are by comparing their overall health and the factors that influence their health in comparison with counties in each state across the country. Our guest in the studio today is our Health Department Director, Dr. Bonnie Sorensen, and we'll find out how Volusia County fared in this year's National Community Health Comparison. Dr. Sorensen, thanks for being with us today.
Thanks so much, Dave.
As we said, this is the third year of this National Health Ranking. Before we talk about this study and how Volusia County did, let's talk about the Robert Wood Johnson Foundation. What's this all about?
Robert Wood Johnson is a philanthropic foundation, a national foundation whose primary interest is health and how to improve healthcare, how to improve health of communities. So they have funded the University of Wisconsin to publish these county health rankings, these snapshots of the health in every county in the nation.
As we said, this is a national study, and I think there's something like 3,000 counties across the United States, so this is no small undertaking.
Exactly. There are over 3,000 counties across the nation, and although we thought this was only going to last for 3 years, it sounds like it's going to be an annual checkup, annual publication.
As you look at the questions and the factors in this study, kind of break it down as to what sort of questions they ask and the categories and so forth.
They give us a score or a ranking about our overall health in our community. And the overall health is measured by looking at the number of years that are lost in our community because people die before they're age 75.
Right.
Everyone's expected to live to be age 75, and if they die young, then we lose all those years, and that's a major impact on our health outcomes. They also look at how people feel.
Right.
Do they feel like they're in good health or not good health? Do they feel like they have physically bad days or mentally bad days? And that's how they measure our overall health in our community.
And I thought it was sort of interesting in looking at the categories, and they, I guess each one were weighted by a number of points. Healthcare facilities and access to those facilities is a relatively small portion of the weighted score.
Yes, and again, the point is health is not about health care. The clinical care that's available in the community only gets 20% credit. It only contributes to 20% of our health, whereas health behaviors contribute 30% to our health, socioeconomic factors contribute 40% to our health, and the physical environment contributes another 10%.
So socioeconomic factors, I would think, Dr. Sorensen, if I'm correct, would tie directly with habits, doing healthy things or unhealthy things like smoking, drinking, eating too much, that sort of thing.
Yes, they are connected. If you live in a poor neighborhood that doesn't have safe streets or parks, if you live in a neighborhood that doesn't have healthy food options, either from a restaurant perspective or from a grocery store perspective, your ability to live a healthy life and exhibit healthy behaviors is diminished.
Right. And I bet you it's probably no surprise that one of the worst things that anyone can do, no matter where they live, is to smoke cigarettes, and that would fall into this risky behavior kind of category.
Yes, there are a number of behaviors that are good for our health and that are bad for our health, and smoking is one of the worst behaviors. Smoking leads to almost as many deaths in our nation and our state as does cancer. So smoking is a huge factor.
Where does the state of Florida rank in all of this?
Generally, Florida ranks in the middle. We are doing better. We used to rank 42 out of 50 states, and then we were 37. Now we're up in the upper 30s. So our health in Florida is getting better over time.
Why is that? Do you know?
Well, hopefully it's because of our healthcare system. It's because we're promoting healthy behavior, not smoking, lack of risky sexual behavior, eating better, being more physically active. Plus the socioeconomic conditions are always a concern in Florida compared to other states, and we can work on that too.
In Florida, there were 67 counties. Where does Volusia County stack up in all of this?
This year, Volusia County ranked 37 out of 67 counties in overall health. However, our behaviors, our risk factors, we ranked actually 32. So what that means is that because our factors are better than our overall health outcomes, over time, because the factors are improving, our overall health will improve as well.
Well, but am I not right in thinking that Volusia County actually kind of slipped a couple of notches this year as opposed to last year? I don't know if that's statistically significant or not.
Yes, last year and the year before we ranked 35 out of 67. This year we ranked 37 out of 67, which could be because we've slipped or because other counties are working harder to get better.
So we're 37th out of 67. It is somewhat in the middle. As the health director for Volusia County, what's your reaction to that? Is that good, bad, or otherwise?
Well, I think it reflects the socioeconomic conditions in our community. We could do better with our health behaviors. We could do better and reduce the amount of smoking and increase the amount of physical activity and increase the amount of healthy nutrition, and that would improve our overall health.
And we did well, if I'm not mistaken, we did well in healthcare facilities. And we have great facilities here.
Yes, the factor that influences health, only 20%, we are very good. We have robust clinical care systems in our community. The number of doctors, nursing schools, family practice, residencies, and taxing districts, all that contributes to our clinical care, and we rank fairly high. We rank 15 out of 67 for clinical care.
Overall, Dr. Sorensen, tell us what the top 2 or 3 most healthy counties in the state of Florida are. Where are they?
The most healthy county is really the county just north of us, St. Johns County.
Interesting.
Seminole County ranks relatively high. Collier County, it's generally the coastal counties that rank high, whereas the counties that are in the middle of the state, and especially the Panhandle, rank very low.
Again, would you attribute that to an income factor, or what do you?
Income is one of the factors. Graduation rates is a factor. The kind of culture in the community as to whether they feel healthy or not, mentally and physically, all that plays a role. And obviously the counties that are ranking high are using that as an economic argument for economic development, that come to our county. We have excellent health care, we've got educated employees, we have a healthy environment. That's really a positive feature for the counties that rank high.
So now Volusia County and all these other counties, we've got 3 years of this data. You're beginning to build, I guess, a little bit of a trend.
Yes.
So what do you do with this data? I mean, how does it help you?
it does point out to us where we are the most weak compared to other counties in the state. So we are working on looking at the data in a more granular way. It's one thing to have a snapshot of the health of the entire county, but as we know, our county is very large. We have zip codes and neighborhoods that are impacted adversely compared to other zip codes and neighborhoods. So we're starting to look at that data on a more granular level, understand why the health in certain neighborhoods is adversely impacted, and what could we do from a policy perspective, from an advocacy perspective to improve the health in those communities.
All right, so I'm going to give you a magic wand, and you can do a couple of things to immediately move us up the dial. How would you do that? What would move this dial?
I think the health behaviors are critical in the sense of less smoking and less obesity, but also the economic conditions. If 5% more people became educated, had a little college in our community, if 4% had a little better income, we could reduce the number of deaths and the amount of chronic disease in our community tremendously, which would also translate into saving millions of dollars in our community, just with a little bit of nudging.
I know two things that the Volusia County Health Department has been very actively involved in terms of public education is the dangers of smoking and the need to quit smoking, as well as I know you've been involved in campaigns and so forth on obesity, because obesity at all levels, but particularly in the kids, is a big problem.
Yes, and it's particularly in certain zip codes and neighborhoods. So the more we can focus on health promotion and kind of change the culture in Volusia County that we want to be healthy, we just have great opportunities in our community to be outside and to enjoy the environment in our community, and we appreciate all the efforts to market that.
Quit smoking, quit the heavy fat, get on the bike and start riding. Huh?
Yeah, it's like eat less, move more, and don't smoke.
Dr. Sorensen, for those folks that may want more information, perhaps they want to take a look at the study, how do they get access to it?
This is on a website called countyhealthrankings.org.
Okay.
You can see any county on that website, including ours.
Well, fascinating information. Sounds like Volusia County could do better, but it sounds like we're doing better than others. So,
yes, absolutely.
Our guest today, Dr. Bonnie Sorensen, Director of the Volusia County Health Department. Dr. Sorensen, again, thanks for being with us.
Thank you so much.
And with that, Amber, we'll go back to you.
Thanks, Dave, and thank you for watching Volusia Magazine. If you have any questions about our program, you can give us a call at any of the numbers you see here, or you can log on to volusia.org. You can also watch the show online. Just go to volusia.org and click on the Volusia Magazine icon. And we hope you won't forget to listen to Volusia Today, Volusia County Government's public information radio broadcast. Volusia Today airs every Tuesday and Sunday mornings on the local radio stations you see on your screen. For Volusia Magazine, I'm Amber Patterson. Have a great evening.